Hello, this is Dr. Girija Wagh from Pune, Maharashtra. I'm a gynecologist and in practice for the last 29 years, and I deal with fertility practices as well as OBGYN, that is delivery issues. In this particular episode, we are going to discuss about the couple health optimization before IVF conception. Now, first and foremost, let's understand the basic crux of the matter. Why does a couple commonly require to take help of assisted reproduction? The reason has been identified today that many couples decide to embark upon conception after a little while, or maybe they get married a little late, so the age is increasing. But aging is not everything. It's not about age. It is about other challenges, because aging gets accelerated because of abnormal lifestyles. One of that is obesity, abnormal weight, abnormal dietary practices, lifestyles, vices such as drinking, smoking, alcoholism, any kind of other drugs or medications, diseases. So many things are responsible to challenge your basic reproductive function. The processes of making eggs in the woman, that is ovulation, and making sperms in the man, that is spermatogenesis, are very, very delicate processes of our body, and they require that the health of the man and the woman is normal. Not only that, after we embark upon assisted reproduction, the quality of these eggs and sperms have to be good, and then the woman in whom we are going to transfer this embryo, even her health has to be good, because pregnancy definitely is a metabolic, hemodynamic challenge on the body. Your body increases in size, there are a lot of changes in your blood, circulatory system, so many things matter, and therefore it's important that before we embark upon assisted reproductive technology, also it is important that we have a healthy lifestyle. So what do we do? There's one very simple checklist that you can do. What is my weight? Is my body mass index normal? Do I have good strength, that is respiration? Do I do exercise? Because exercising helps in improving bodily circulation, keeping you calm, stabilizing your hormones, and eventually helping in all these reproductive functions better. Am I having good muscle strength? This can be acquired only by doing good physical activity. Do I have any illnesses like diabetes, hypothyroidism, obesity, heart disease? Am I taking any medicines for any reason? Like maybe you must be having fits or taking treatment for some skin ailments. All these are required to be regularized beforehand. Am I suffering from anemia? Because that's very common in our country. Your hemoglobin always should be 12 grams per deciliter. Then, am I thinking well? Am I having good attitude? Am I too stressed out? How is my sleep cycle? Do I sleep well? Because sleeping is important for ensuring good melatonin stimulation into your brain, which is going to help your reproductive function better. Then, am I too anxious? Am I suffering from any psychological or psychiatric disorders which require to be taken care of? Because remember friends, it's not only about getting pregnant or conception, it is also about becoming a good parent to your child. It's a commitment for lifetime, because once your baby is born, that baby definitely requires healthy parents, a healthy mother and a healthy baby. So it's extremely important that before we embark upon any conception, even with assisted reproductive technology, you must optimize your health. And many of these things, I've seen couples, especially husbands, saying, there's nothing wrong with me, doctor, I'm absolutely healthy. But when we investigate them, we find out that there are some problems. There are nutritional deficiencies, the semen counts are not up to the mark, they have habits like drinking, smoking, are stressed out, all these things require to be taken care of. And definitely, this has to be through a structured advice. And this can be done by us. So whenever you have challenges, whenever you feel that you require to be analyzed, please come over. Before embarking upon any fertility treatment, any conception, it is essential that you meet a doctor for guidance. Because it's not only about lifestyle, but it is also about immunization. Because couples, before embarking upon getting pregnancies, it is important that all of you are protected from preventable diseases like rubella, hepatitis, and human papillomavirus. So feel free to connect to us anytime when you require to plan your babies. This is Dr. Girija Wagh, gynecologist and fertility specialist from Pune, Maharashtra. I am in practice for the last 29 years.